If you're over 60, please listen for a few minutes. The way you take vitamins can raise stroke risk. Many people wake up one day with a weak arm, slurred words, or poor balance. It can happen without pain and without warning. The surprise for some seniors is this: the risk does not only come from smoking or junk food. It can also come from the way supplements are taken, dose, timing, and stacking. Millions of older adults use vitamins for bones, energy, heart, and memory. But high doses, wrong timing, and mix-ups with medicines can raise stroke risk or cause bleeding. This is not about fear. This is about safety. If you take supplements now, you deserve a clear plan that fits an older body. Slower kidney filtration, different liver handling, and more fragile blood vessels. In this video, you will learn 5 vitamins to handle with care after 60, the safe ranges to discuss with your clinician, and the simple steps that reduce risk. You will also get a short food-first plan and a safety checklist you can use today. Let's start with number 1. Vitamin D, the bone helper that needs a dose check. Vitamin D supports calcium absorption and helps keep bones strong, but older adults can run into trouble when intake climbs too high or timing is off. Extra intake for long periods can raise blood calcium and place stress on blood vessels, which is not ideal for arteries that are already less flexible with age. Many bottles show 5,000 IU or even 10,000 IU per capsule, and that amount can be excessive for people who are not deficient. Large evening doses combined with nighttime dehydration can also work against steady control, so many seniors feel better using morning dosing and drinking water through the day. Safer use starts with a 25OH vitamin D blood test so you and your clinician can see your baseline and agree on a plan. Typical needs are modest for many seniors. Some do well around 800 to 1,000 IU per day when deficiency or risk is present, though your exact dose should follow medical guidance. Those who also take calcium or certain heart or blood pressure medicines need extra care because stacking products can push calcium higher or affect pressure control. People using thiazide diuretics or with a history of kidney stones should have a careful review. Hydration habits matter as well. A glass of water with breakfast and regular sips during the day support balance, while large late-night pills are best avoided. Pay attention to signals that suggest too much vitamin D or high calcium: nausea, constipation, unusual thirst, confusion, more frequent urination, muscle weakness, or new heartbeat changes. Call your clinician if these appear, and bring a complete list of all vitamins and fortified drinks you use so the total intake is clear. Food can cover a good portion of daily needs in a steady way. Salmon or sardines, eggs, and fortified milk or plant milks are practical choices you can rotate through the week. Sun exposure may help in some cases, but skin type, medications, and local UV levels affect safety, so ask your clinician what is appropriate for you. If a supplement remains part of your plan, pick the lowest effective dose, avoid doubling a multivitamin with a separate high-dose capsule, and recheck levels after a few months to confirm the dose still fits. A measured approach, testing, modest dosing, morning timing, hydration, and food-first choices keeps vitamin D working for your bones without adding strain to your heart and brain. Number 2. Vitamin E, the antioxidant that can increase bleeding with certain medicines. Vitamin E appears in many multivitamins and heart or skin blends, and small amounts from food support normal cell protection. Risk rises when a high-dose capsule is added on top of medicines that thin the blood. Many adults over 60 already use acetylsalicylic acid, aspirin, clopidogrel, or warfarin. Others take direct oral anticoagulants such as apixaban, rivaroxaban, edoxaban, or dabigatran. Vitamin E can lessen clotting activity, so stacking a large supplement with these prescriptions can tilt the balance toward bleeding, including bleeding inside the brain. The same concern applies to people with a history of stomach ulcers, eye bleeding, liver disease, untreated high blood pressure, or recent falls. Daily requirement is modest, about 15 milligrams, which equals roughly 22 international units. Store shelves often show 200 to 1,000 IU per soft gel, far beyond what most seniors need. Several products taken together can push totals even higher because vitamin E also hides in immune blends, hair, skin, nail formulas, and some meal replacements. Start with a full inventory of everything you take, pills, powders, and fortified drinks, and total the vitamin E across the day. Bring that list to your clinician or pharmacist and ask whether a separate vitamin E capsule is necessary, especially if you already take a blood thinner or daily acetylsalicylic acid. Food works well and is safer for most. A small handful of almonds or sunflower seeds, spinach or other leafy greens, avocado, and cooking with moderate amounts of sunflower or canola oil deliver vitamin E in balanced amounts that the body handles predictably. When a supplement remains part of the plan, choose the lowest effective dose, take it with a meal, avoid doubling a multivitamin with a high-dose standalone, and pause non-essential vitamin E before dental procedures or surgery if your clinician advises. Watch for warning signs and act early. Easier or larger bruises, frequent nosebleeds, bleeding gums when brushing, black or tarry stools, red or brown urine, unusual or severe headaches, sudden vision changes, or new weakness or confusion. Seek urgent care for severe or sudden symptoms. Review other products that can raise bleeding risk, including high-dose fish oil and non-steroidal anti-inflammatory drugs, for example, ibuprofen and naproxen. Keeping vitamin E simple: food first, careful label checks, coordinated review with a professional, and the lowest dose that fits your situation helps you capture the benefit while avoiding preventable harm. Number 3. Vitamin B6 supports nerve function in small amounts, but high daily doses can injure nerves. Vitamin B6 helps the body use food for energy and supports healthy nerve signaling. Yet trouble starts when daily intake stays high for weeks or months. Long-term use of 50 to 200 milligrams tablets or stacking several products that each contain B6 can lead to sensory nerve injury with tingling, numbness, and unsteady balance. Older adults face extra risk because drug regimens, smaller body size, and slower clearance can magnify exposure from what looks like a standard supplement. Product labels for nerve, brain, or energy blends often list 50 to 100 milligrams per serving, while a multivitamin may already contribute several milligrams. The totals add up fast. Most seniors only need low single-digit milligrams each day, roughly 1.5–1.7 milligrams for many people, and any higher amount should be clinician-directed for a clear reason and time frame. The U.S. tolerable upper intake level is 100 milligrams per day, but staying well below that, unless a professional prescribes and monitors it, reduces risk. Practical safety steps begin with reading every label you use, counting the total per day, and avoiding mega B stacks. People with kidney disease, heavy alcohol use, or Parkinson's disease are treated with levodopa. Without carbidopa, need individualized advice because interactions and sensitivity differ. If a supplement remains part of your plan, choose a modest dose, take it with a meal, keep dosing consistent, and schedule a periodic review to confirm the amount still fits your needs. Early warning signs deserve quick action. Pins and needles in the feet or hands, burning soles at night, clumsy or fine finger work, button zippers, new balance trouble, or a shakier walk. Stop high-dose B6 and contact your clinician if these appear. Food easily supplies safe amounts. Chicken a few times per week, potatoes, bananas, chickpeas, and fortified cereals provide steady B6 without pushing totals too high. Keep a written list of all pills, powders, and fortified drinks because some beverages add extra B6 that goes unnoticed. Splitting very high-dose tablets is not a workaround unless a clinician instructs it. Unequal fragments can still deliver too much. A measured approach, food first, low dose when needed, careful counting across products, and prompt attention to symptoms. Lets B6 support nerve health without drifting into the dose range linked with nerve injury. Number 4. Vitamin A, vision support that can build up over time. Begin by treating vitamin A with care because the preformed type, retinol and retinol esters, accumulates in the body. Preformed vitamin A stores in the liver and body fat, so the system does not clear excess quickly. With long, high intake, surplus retinol can raise pressure inside the skull, often called pseudotumor cerebri, which may bring headaches that worsen, blurred or double vision, dizziness, nausea, and thinking changes that can resemble a neurological event. Symptoms deserve prompt attention, especially in older adults whose vessels and organs tolerate swings less well. A number of vision and skin formulas supply 5,000, 10,000, or even 25,000 international units per softgel, while a multivitamin may already contribute more retinol. Totals climb further when both are taken daily. Older adults benefit from a single, well-chosen source rather than overlapping capsules that drive intake higher than intended. Label reading helps. Look for retinol or retinol palmitate for preformed vitamin A and beta-carotene for the plant form that the body converts as needed. Food-first choices fit most plans: carrots, sweet potatoes, spinach, kale, winter squash, and small servings of liver deliver vitamin A or carotenoids in amounts the body regulates more predictably than a large pill. Should supplementation be required, select the lowest dose that meets your plan, avoid stacking products, and stay away from high-dose retinol unless a clinician prescribes and monitors it. Health authorities place the tolerable upper intake level near 3,000 micrograms, retinol activity equivalents per day, about 10,000 IU of preformed vitamin A. But many seniors need far less to meet goals. Those with heavy alcohol use, bone fragility, or long-term use of retinoid medicines, for example, isotretinoin or acitretin, need personalized guidance because sensitivity is higher and interactions are possible. Bring a complete list of multivitamins, eye blends, skin and hair products, and fortified drinks to your next visit, so your clinician or pharmacist can total the retinol content and remove unnecessary overlap. For day-to-day safety, keep doses modest, review every few months, and watch for persistent headache, vision changes, unusual fatigue, dry skin, bone pain, or easy irritability. Sudden or severe symptoms warrant urgent care. Balanced intake managed with professional advice supports eye comfort and brain safety while avoiding buildup that can undermine independence. Number 5. Niacin, vitamin B3 that can unsettle blood pressure and strain the liver at high doses. Niacin, also called vitamin B3, appears in many multivitamins and heart support products, and very large amounts are still sold as standalone tablets. High intake pushes blood vessels to widen quickly, which brings a hot red flush to the face and head. Soon after, vessels can tighten again, creating swings that feel uncomfortable and, in some older adults, unsafe. Doses in the range of 500 to 2,000 milligrams per tablet drive this effect and can also burden the liver, especially with extended release or so-called flush-free versions that hide early warning signs. Blood sugar may creep upward in people using large amounts. Gout can flare because uric acid rises, and those taking statin medicines sometimes need closer monitoring due to a small added risk of muscle problems. Daily needs from diet are modest, measured in tens of milligrams, not hundreds, so a balanced plate usually covers requirements without side effects. Chicken, turkey, salmon, peanuts, beans, and whole grains supply steady vitamin B3 that the body handles predictably. Before adding a capsule, total the niacin you already get from a multivitamin and any heart blend to avoid accidental stacking. If a supplement remains part of your plan, keep the dose low, use it only with professional guidance, and skip high-dose products unless your clinician prescribes and monitors them. Timing matters for comfort. Many people tolerate morning use with food better than a large pill at night. Hydration through the day also helps. Watch for signals that mean the dose does not suit you. Strong flushing with pounding in the head, lightheadedness, itching, dark urine, yellowing of the eyes or skin, chest discomfort, new irregular heartbeat, or unusual fatigue. Contact your clinician promptly if these appear or worsen. For cholesterol control, discuss food changes, weight management, regular activity as approved, and modern prescriptions that match your medical history before considering pharmacologic-level niacin. Keeping vitamin B3 simple, food first, careful counting across products, and clinician-led decisions when a pill is truly needed protects the heart and brain by favoring stability over swings. Safer alternatives, real food over pills. Safer alternatives focus on meals built from whole foods that cover common gaps without relying on large capsules. For breakfast, choose Greek yogurt or one egg with berries, oats or whole grain toast, a small handful of walnuts or almonds, and water at room temperature. Midday plates can feature salmon or sardines twice a week for omega-3 fats, a pile of dark leafy greens dressed with olive oil and lemon, beans or lentils for fiber and minerals, and whole fruit for a gentle finish. Evening meals can center on chicken or tofu with mixed vegetables such as broccoli, carrots, peppers, and onions, plus brown rice or quinoa for steady fuel. Snacks work best when simple and portioned. A banana, carrot sticks with hummus, or a small square of cheese with whole grain crackers. Cooking methods that keep oils modest, bake, steam, simmer, or grill, help maintain balance. Herbs, garlic, ginger, pepper, and citrus lift flavor while keeping added salt controlled. Rotation across the week builds variety. Greens most days, fish a couple of times, beans several times, and different colored vegetables on repeat. Beverages stay straightforward with water, unsweetened tea, or black coffee if tolerated, with caffeine earlier in the day to protect sleep. Packaged foods deserve a quick label scan. Pick short ingredient lists, low added sugar, and reasonable sodium per serving. Fortified cow's milk or plant milks can assist with vitamin D and calcium, while eggs add natural vitamin D and choline. Meal timing that is consistent supports digestion and medicine schedules. Light walks after eating may fit if your clinician approves. Kitchen setup guides choices. Keep washed greens, pre-cut vegetables, canned fish, and beans at eye level for fast meals. Portions stay comfortable rather than strict to keep the routine sustainable. Menu adjustments should reflect conditions and prescriptions discussed with your clinician or dietitian. This calm, repeatable pattern delivers steady energy and protective plant compounds while lowering the need for high-dose supplements. How to build one master supplement list, safe and simple. At 60+, keep supplements simple and coordinated. Write one master list of every pill, powder, drink mix, and fortified product you use, including dose and time. Total daily intake for vitamin D, vitamin E, vitamin B6, vitamin A, retinol, and niacin in international units or milligrams. Bring the list to your clinician or pharmacist and agree on one streamlined plan that avoids duplicates and high-dose standalones. Favor the lowest effective dose. Maintain consistent timing, often with breakfast or lunch unless advised otherwise. Avoid late-night large doses. Read labels whenever you add or replace a product. Review interactions with blood thinners, blood pressure, diabetes, thyroid, seizure, and heart medicines. Recheck labs on the schedule your clinician sets. Store bottles in one location. Use a weekly organizer if helpful. Skip impulse mega purchases. Document brand, strength, and lot numbers for easy reference. Update the list after any change. Set calendar reminders for refills and reviews. Travel with a printed copy to share with healthcare teams. Share the plan with a family member who helps you manage medications. Aim for stability. Modest dosing, clear records, consistent timing, and professional oversight. That steady system protects independence while reducing avoidable risk. Keep it simple, steady, supervised. If you found this video helpful, please like, comment, and subscribe. Then share this video with someone who may need it, and turn on the notification bell to get our next senior-friendly guide. Disclaimer: this content provides education only and does not replace personalized medical care. Vitamins and herbal products can interact with prescriptions and medical conditions. Do not start, stop, or change any supplement or medicine without speaking with a licensed clinician or pharmacist who knows your history, current diagnoses, and laboratory results.